Good afternoon. It's 2:01, so I am going to call this meeting of the Back to Business Task Force, specifically the subgroup that will be doing the reopening guidance for aquatic facilities, lodging, and hospitality industry. So I'm going to start off by taking a quick roll call just to make sure that we have everybody here and that we know who is joining us on the phone. So I'm going to start off by the members of the task force, and then I will also introduce the members of staff that are present. And I'm just pulling up my list. Here it is. So I'm going to start off by doing the roll call. Mr. Kent Blumenthal. Here. Mr. Russ Bond. Ms. Nicole Dahl. Mr. Curtis Dawson. Mr. Brent Durad. Yep. Mr. Grant Dipman. Mr. Dale McDaniel. Ms. Teresa Mudd. Mr. Richard Osron. Here. Mr. Andrew Stegan. Here. Ms. Laura True. Mr. Mark Van Buren. Joining us today on the staff side is the county administrator, Mr. Chuck Huckleberry, as well as our manager from the Consumer Health and Food Safety and our senior leadership, Lonnie Anderson and Gary Frucci. We also have other folks, Joe Barr joining us from Parks, as well as a variety of folks supporting us from the IT department. And so I'm going to go ahead and turn it over to Chuck to sort of kick us off, and then I will talk about the overall task force goal.
Okay, thank you, Dr. Garcia. One of the tricks, I think, in wearing a mask is trying to figure out how not to fog up your glasses. So if you're all having the same problem I have reading something after you breathe, I think you got to breathe in, and then the fog goes away, and then you can read, and so therefore keep going. I think this is the second meeting. We had restaurants and bars last Thursday. This is the second group. We'll have meetings with others throughout the week and then beginning into next week. And so this process is just the first iteration of trying to hear what your ideas are and what you think ought to happen, so that we can kind of take notes of those conversations and then come back with a list of issues or a list of criteria that we think is probably appropriate. It's different than your typical codes, because many of your codes were basically adopted with not this in mind. And so the question then becomes, how do you do certain things to improve the chance of reducing the infection or the spread of COVID-19? What we said from the very beginning, at least from our criteria, will all be driven by public health science. And frankly, that is the main driver of this whole discussion. So I think that's really all I have, other than just simply thank you all for devoting your time to this process. What we will do is take the input, allow you to actually write something down if you'd like to send in something later as you think about it. We will then publicize all that information so that the public gets to see it. A lot of the material that I think the staff has provided is also published on our website. And more than likely, then we will have a couple of follow-up polls or, questions that we give to the public to say, what do you think about these various measures, and which ones do you agree with and which ones don't you agree with, or how would you rank them, so that we have a better idea what to include in the final series of temporary regulations that would deal with the reopening or measured reopening of these facilities. So thank you, Dr. Garcia, and I think we should probably just proceed.
Awesome. I want to recognize Ms. Laura True, a member of the task force who has just joined us too. I'm going to take the opportunity to sort of set up what the goal of this particular task force is. Last Wednesday, the governor began to lift some of the restrictions for retail, mostly aimed at facilitating drive-up and by appointment types of retail interactions. We believe that next week we will be hearing about a loosening of restrictions specifically for restaurant operators, and we believe that subsequent to that, there will be further guidance on other types of business establishments. And as we start to think about how we reopen different sectors of the economy, we wanted to get the input of key stakeholders to engage you in a discussion about the kinds of things that you anticipate doing and the kinds of things that you think will make sense, with the goal of making sure that whatever guidance the health department or the county provides is based on not just on good science, but also on good public stakeholder feedback. And so that's the purpose of the conversation today. Again, it's not that everybody's going to be back to business as usual in a week, but we should begin to plan for how we will be ready to take action if the governor lifts the stay-at-home order, or if the governor, when the governor loosens up the restrictions, whether it comes in a couple weeks or whether it comes in, 4 or 6 weeks, it is immaterial. Either way, we need to do some serious planning. So that is the background for that. Our health department director today is busy onboarding our new our future health department director, and so he cannot be on with us today. Dusty, can I share my desktop with the group so that they can see what I'm seeing? I don't think they're seeing what's on my screen. Is that a possibility? No, I'm not on the Surface. I'm on this desktop up here. Perfect. Okay. Sorry. We're all learning on this in this process. I just wanted to very quickly review for you where we are overall as a state and overall as a county in terms of the number of cases that we have. Overall, the state is reporting 8,919 cases with 362 deaths. In Pima County, the number is proportionately smaller, 1,364, with 89 deaths reported. One of the things that has been a big activity for us has been trying to encourage testing, and in Pima County, 10,212 tests have been performed. So I think that my way of telling you that this is a complex situation, and it continues to be one that is fairly fluid, that we continue to follow relatively closely. Really importantly for you to, if I can make this a little bit smaller, for you to realize that most of the cases that we have had are in two groups, in folks who are in the vulnerable 65 and older population. We also have a disproportionate number of cases in the 20 to 44-year-old group. These cases are mostly first responders and healthcare workers, and so these aren't people who are actually ill or who are requiring hospitalization, but these are people whose tests are positive and who we are tracking in some form or fashion. A lot of commentary has been going around in terms of the racial ethnic distribution, and you can see that for our county, white non-Hispanics represent about 27% of our cases, while Latino Hispanic represents about 28% of our cases. The other thing I want to share with you, which I think is interesting and important, is I want to give you a sense for how this pandemic is evolving in this county. So on the right-hand side of the screen, this part here, that's the total number of positive cases and by the date that the test was performed. And on the bottom of the axis, you see the day that the test was collected. So this is the May 4th test collection that ended up being reported March 4th test collection that ended up being reported on March the 9th, which was our very first case. What I want you to pay attention to the fact is that we have steadily increased in the number of cases. We do appear to plateau. We may be plateauing right now. I always tell folks, community, to always disregard the last 5 to 7 days because there's a reporting lag. Realize that when you get a test, that test is not immediately visible to us in the health department. The test result, if positive, gets sent up to the state, and then the state transmits that result back to us. The lag between getting a test collected and the report to the county can be as much as 2 to 12 days, depending on the particular laboratory. So you'll always see a little bit of a lag. Bottom line, though, from my perspective, even if these numbers increase, are adjusted upwards, which they will, this last week's worth of numbers, I still believe that we are starting to see the plateau. Please understand that part of the issue here is that, and the same case applies for the deaths that have occurred both in Pima County and the state. We're starting to see what I believe are plateaus. Again, the last 7 days get adjusted upwards as the data mature. Really, really important for you to understand that that part of the reason we've had some significant success is because people have been pretty darn good about social distancing and the stay-at-home order, and that has been much more effective than many of us would have anticipated. So we're doing something right. We obviously can't take the brakes completely off, but we do need to start planning for what the world looks like after that. I will take questions from the task force with regards to the status of the pandemic in our community, if there are any. Sir, Mr. Blumenthal. I'm going to ask people as they speak, both on the phone and in the room, to please identify themselves just for the purposes of everybody else who's joining us by the web stream. And if you could do that and speak very clearly into the microphone, that would be very appreciated. Mr. Blumenthal.
All right, thank you, Dr. Garcia. My question has to do with testing. And out of the gate, when the pandemic first kind of started and entered our area, the testing was all about testing for the COVID-19, the virus. And then conversations and discussions are, well, there's also a different testing relative to whether or not a person has antibodies. So my question for you is, how do you differentiate between the two, and where is the county relative to its accessibility to tests when for anyone or everyone who feels a need, whether it's in the health community or someone who's exhibiting some symptoms? Thank you.
Mr. Blumenthal, that is an excellent question. For the first part of the question is there's two different types of tests, and the tests that we believe are the more important and the ones that certainly we have the longest track record and the largest number of are the PCR tests, polymerase chain reaction tests that are actually looking for the virus, right? They put a swab either in your nose, actually in your nasopharynx. They go straight back. It feels like they're hitting your brain, or in your oropharynx, or in your throat, and then they look for those viral particles. That test tells you if you are infected at the time that you are being sampled. That test, there have been 85,000 performed in the state of Arizona and about 10,212 performed in Pima County. That represents less than 1% of the population. To me, that testing is still very underutilized, very under-available, and I think that we need to have higher levels of testing in order to have a greater degree of assurance. The other thing that's really important for you to understand with regards to the current testing regime, because of the short supply of these kinds of tests, the main people who have been tested have been people who are very sick in the hospital, people who are healthcare workers or first responders who are symptomatic. So it's not the average Joe or Joanne that is being tested. It is folks who are sick, and it's not just folks who are sick. It's folks who are sick enough to seek out medical care. So I think that we still have a ways to go in order to achieve good test coverage. There's just not that much test kits available and testing capacity. The second test you talked about is the antibody test. The antibody test it gives you an idea of whether your body has actually developed antibodies, that is, the things that you need to fight off a particular infection. When you have evidence of IgG antibodies, it means that you had an infection previously and that you are likely protected. We are still trying to understand deeply what these kinds of test results mean and whether we can actually say, you've got an IgG, you're safe, you can go take care of somebody who's sick, or not. At this point, we're still learning a lot about that. A lot fewer of those tests have been performed in Pima County. I would say fewer than 1,000. And that continues to be something that we are continuing to track. But certainly this may be something that has applicability for, in the future, depending on what the research shows, may have applicability for workers in the hospitality industry and being able to understand who's at greater and lesser risk. I will take other questions from the task force before moving on, if there are any from the phone. Mr. Stegan?
The 89, I think you mentioned there's 89 deaths in Pima County. How many of those do you know that are nursing home fatalities?
So, I think I'm not sure exactly. Are you asking how many tests have been performed in nursing homes? Oh, sorry about that, Mr. Stegan. I misunderstood. So I can tell you that of the 89 deaths that have occurred in Pima County, just over half have occurred in long-term care facilities, assisted living, or other housing for elderly folk. Sorry about that. I didn't understand the question. Any questions from our participants on the web? If there are not, I'm going to proceed to the next agenda item. I'm going to turn it over to our Consumer Health and Food Safety crew. Part of the reason why the Consumer Health and Food Safety crew at the Health Department are the lead staff for this activity has to do with the fact that these are the folks that you will be interacting with, that you already are interacting with in the process of permitting your restaurants and your pools. And so we have already had a very good, very robust conversation about restaurants that occurred last Thursday. And we're in the process of synthesizing that conversation and sending out a document. The goal today is to think about specifically pool and other lodging-related kinds of issues, and to start thinking through what might be guidance that we might use in our community. The other component that we've put in the same group is gyms and sports facilities, because we also believe that when the restrictions on lodging become looser, that's also when we will start seeing movement in that space. And because there are a lot of common environmental concerns, that is the reason why we are grouping these 3 subject areas. I'm going to turn it over to Lonnie and to Gary, who will be staffing this.
Hi, good afternoon, everybody. My name is Lonnie Anderson. I am the Division Manager with Consumer Health and Food Safety. Thank you, everybody, for joining us, and I hope that you can definitely provide us a lot of feedback related to the establishment you're involved with. You can always reach us via email as well if there's something you would like to address outside of this meeting, but I appreciate your time. As mentioned, the Consumer Health does regulate aquatic facilities, which include any semi-public and public pools, spas, and splash pads. With that being said, the big concern is COVID-19, and what we do know is the CDC does indicate that there is not any evidence that the virus can be transmitted in pool, spa, or splash pad water. The important thing to know is that the filtration system in the pool, the equipment is functioning properly, and that there's proper disinfectant in the pool. So knowing those things when we reopen is kind of why we're here today, to talk about the important things that everyone should be checking prior to reopening. We have developed some information here and guidance for reopening aquatic facilities. That information should have been distributed to you. Hopefully you got a chance to look at it, and we'll pull it up here on the screen soon. I'm going to hand it over to our program manager, Gary Frucci, and he'll go over the document in more detail.
And if you'll note, the documents have draft watermark all over it, precisely because this is our staff attempt to try to put this together, but this is still very much a working document.
Okay, so we developed some guidance for operators of,
Forgot from last week, sorry about that. So we've developed guidance for what does reopening look like for all aquatic facilities, which include pools, spas, and splash pads, both public and semi-public. And I'm just going to go down the checklist quickly, and then we can have any kind of discussion about what's been proposed. Nothing here is any different than what you normally do, day-to-day operations, as outlined in the Pima County Pool Code. But this is just, again, ensuring, taking extra steps, everything's ready to go. We reopen. We don't, beyond the concerns with COVID would be the normal recreational waterborne illnesses that we can see from year to year. So going down the list here, operators must ensure the following conditions are met prior to reopening. Perform a safety check, ensuring that the enclosure fencing is secure and entry gates are self-closing and self-latching. Pool, spa, or splash pad are free of hazards. Filtration and disinfectant equipment is functioning properly. Next, Pima County Code 8.32, water quality standards. Excuse me. Disinfection requirement, free chlorine residual 1 to 5 parts per million. Bromine 2 to 10 parts per million, and a pH of between 7 and 8. Chemical logs are filled out as required. Water shall be maintained free of turbidity and shall be sufficiently clear so that the main drain outlet is clearly visible from the side of the pool. Ensure all required safety equipment is installed and in good repair. Management offices shall establish guidelines for physical distancing, 6 feet between people unless they live in the same unit, and post appropriate signage, including do not enter if ill and preventing the spread of COVID-19. Both of these documents are available on the, for you to print on your own on the COVID-19 webpage, or we have plenty of copies we can distribute. Just have to request during, even before reopening, if you have a request, let Consumer Health and Food Safety know, and we'll get those out to you. We're recommending spacing pool furniture to encourage social distancing and/or removing any excess furniture to provide space between bathers. Do not exceed the maximum bather capacity. High contact surfaces such as gate latches, keypads, pool furniture, bathroom door handles, etc., shall be cleaned and sanitized using approved products at least twice per day. Facilities with bathrooms shall be properly cleaned and sanitized at least twice per day, and to post the Pima County hand washing signage. Are there any questions regarding this checklist? Yes, sir.
Right. In terms of the guidelines that are listed here, are we going to be able to move forward with these, or would we be reliant upon the state to provide those guidelines and then follow those guidelines?
We're waiting to hear what the governor's decision, and as Mr. Huckleberry pointed out, this is a draft document that will be revised as needed prior to reopening.
Mr. Durad, your point is a good one, which is we are still not entirely sure of what guidance is going to be coming down from the governor's office, but we still feel a need to try to anticipate as much as possible. We believe that the governor will be less proscriptive on some of these issues that have to do with lodging and gyms, and I believe that the governor will be less proscriptive on issues that have to do with gyms and lodging and pools than, for instance, he will be on the restaurant and retail issue for a variety of reasons, but some of which have to do with it's kind of easier to regulate in other areas. So part of what we want to do is make sure that we've talked through, at least in this community, what makes sense. One of the silver linings is that, as Gary mentioned, just in general, COVID-19 and the actual pool operation is not something that we're worried about. However, crowds and classes and activities, that does become an issue that we start worrying about. And if we continue to have guidance from the governor's office, for instance, that folks should not congregate in groups greater than 10. How does that apply to a pool setting? How do you do a group swimming class, for instance, at the Y? Or how do you do deck service at a resort? I think that's part of the reason why we want to make sure that we start surfacing some of these conversations here. Other questions? Yes, Mr. Stegan.
Sorry, there we go. I don't have, thank you. So the issue in the pools is not, if I understand correctly, not contracting COVID-19 by either jumping in and out of the water, or it's more the social distancing outside of the pool? Is that?
Mr. Stegan, that is how we understand it. Please understand that specifically with regards to the operation of spas and steam rooms where you're aerosolizing liquids, if you happen to have people who are coughing and sneezing, you're aerosolizing that along with the liquids, and so that becomes an issue. That's part of the reason why one of the recommendations is signage that says if you are sick, you should not be in the pool. Typically, that pertains to GI kind of sickness, but in this case, what it really means is if you are sick of any type, if you are experiencing any sort of illness, you probably should be avoiding pools and common spaces.
Okay. And so the second question, would you put pools in the same category as water slides, for example? That's still a water slide, or water parks. You still can't, by just being in the water, you're not going to transmit the COVID-19.
Yeah,
Correct,
I'll let Gary answer that, but I think some of the same issues with regards to aerosolizing stuff are also present, especially in splash pads and things that spray. However, as long as you're keeping sick people out. Gary, do you want to comment?
Yeah, I would agree. It applies to all areas of any aquatic facility, slides, whatever. We're not going to transmit through water, so it's more about preventing the spread person to person, just like any other setting.
Okay, thank you.
Sorry, other questions from our folks who are joining us on the web or other folks here in attendance? Terrific. We'll move on to lodging-related issues.
You want to take that? I'm just going to,
Dusty, will you let us know if somebody is trying to, I'm not seeing any hands raised on the web.
I just want to talk a little bit about ensuring a safe workforce, just like the same discussion we had last week with restaurant operators and other businesses. One of the key public health interventions is going to be ensuring that workers at pools, at any business, at lodging establishments are not working while they're sick. What this looks like is operators having that conversation with, the big challenge of wearing a mask for me is being able to speak with a mask on. So having that discussion with your employees about symptoms, reporting illnesses, deciding on what monitoring you're going to do up to and including taking temperatures and asking questions about symptoms. This is key for all businesses. So the public can be comfortable patronizing businesses and getting out there so they're not at risk from employees, which seems to be a lot of the questions we're fielding now with restaurants that are operating is they're not wearing masks or shouldn't they be wearing masks. Beyond that, the most important thing is, have they been screened? Do they know to report illnesses to their employer? Are employers watching out for symptomatic employees? So I'm going to turn it back to Lonnie to talk about lodging.
Before we do, are there any questions in terms of sort of the employee wellness component? This is about, this is where we talk about how you're going to do symptom checks or temperature checks for your employees, whether or not you're going to require them to use face coverings when they're interacting with the public. Any questions or feedback on those kinds of issues? Yes, Mr. Blumenthal.
Thank you, Dr. Garcia. My question is, it's a focus on the employee, but it also kind of transfers in my mind to a guest, and that is, does a private employer, for that matter, a public employer, have all legal rights to test, say, even take the temperature of their employees? Now, I want to say I was impressed when I came into the building here. This was my first experience on site since the COVID-19 pandemic struck here, that there was a testing set up in the lobby. It was new to me, but I got it. The good news was they let me come in, so I assume that once in my life I'm normal about something, and that's the temperature. But what about any obligation, and is there enough equipment for all businesses to do so if they so choose, to take people's temperatures or any other metrics such as a thermal picture? Thank you.
Yeah, let me address that, since we've been doing this about 10 days now. And I think when you come into this building, the next building next door, another building, or any of the other downtown county buildings, you're going to have your temperature taken. as an employee or a member of the public. And when you came in today, you were a member of the public. And we're probably doing about 3,000 temperature checks a day. And so far, we've had 4 positives. And those 4 positives for members of the public coming in. And once we get a positive, that's over 100.4, they're given a card that says, please contact your physician. And so far, every one of those members of the public have been very, basically, cooperative. With regard to the legal ability, yes, I think the Department of Labor and the other regulations we have seen allows for tests associated with ensuring people are not infected or infectious at work or in a work environment. So temperature testing from an employer perspective is perfectly permissible. When we discussed this same thing in the restaurant group, there's one individual that says, well, I have to check every ID for being over 21, so I might as well do a temperature at the same time. And then you had another restaurant person say, there's some of my clientele who probably get offended at having their temperature taken. In our survey that we actually did, it came out that it wasn't, highly desired by the public who were responding to that survey. And I think there were like, 7,000 responses. And so the wellness checks and the temperature checks are probably more important for employees than it is for the general public. And that's kind of where we see it standing at this point, is probably what will occur in the restaurant regulations that are temporary will be probably wellness checks and temperature checks for employees at a shift or shift change.
The part that is, there's some room for creativity, and the private sector and the not-for-profit sector have a lot to contribute here. We've seen models where, Wynn Hotels is putting thermal scanners so that they know, whether their guests are coming in with a fever or not. The complications of how you do that in the desert are not trivial, but Vegas is a desert too, and they're figuring it out there. The issue of face coverings, again, being required especially for frontline employees who are interacting with the public. And then also we're seeing hospitality sometimes offer face masks to their guests at the time that they come in as part of kind of a welcome pack. Do you want to talk more about lodging now, since we've started to get into it?
Okay, so we are looking at the guideline document for COVID-19 in lodging establishments. So lodging managers and staff can implement these procedures to help prevent the spread of COVID-19. Switch to and use disinfectant products that have been pre-approved by the U.S. Environmental Protection Agency for use against emerging viral pathogens. Disinfectants should be applied during routine cleaning of guest rooms, public spaces, health club areas, and meeting rooms. The current list of pre-approved disinfectants is available on the EPA website. Linens may become contaminated with the virus, so it's also important to add disinfectant when washing laundry. Bed scarves and bedspreads should be washed more frequently. Train housekeeping staff to use the disinfectant safely and correctly. Staff should wear gloves when cleaning. Many of these cleaning products need to remain on hard surfaces for several minutes in order to work. Follow the manufacturer's instructions for proper use to get the most virus-killing protection. Schedule and perform routine cleaning and disinfection of all contact surfaces in public areas, guest rooms, television remote controls, toilet flush handles, door handles, water faucet handles, and flooring. Clean public spaces and the front desk area frequently. If possible, provide disposable disinfectant wipes to front of house staff to disinfect surfaces between guests. High-touch areas in public spaces include tables in the lobby area and buttons on elevators, water fountains, and ice and vending machines. Pins at the front desk and room keys and key cards should also be cleaned with disinfectant. Train hotel staff and post signage to remind guests and workers to wash hands with soap and warm water frequently for at least 20 seconds. If possible, provide alcohol-based hand sanitizer that contains at least 60% alcohol in all guest contact areas and to all staff. In addition, remind staff not to touch their faces and to wash their hands if they do, and do practice proper social distancing between guests and other workers. Begin checking employees for symptoms of illness and keep sick staff at home. The most common signs and symptoms of coronavirus infection are fever, dry cough, and shortness of breath. Symptoms typically occur 1 to 14 days after exposure, though some people are infected and don't have symptoms. The CDC is updating this list of symptoms regularly. Consider requiring staff to wear cloth face coverings if it can be safely managed in public settings. Guests can be encouraged to wear cloth face coverings when not in their rooms. Stay informed and with updated and credible information on the COVID-19 virus. Follow information listed by the CDC, the Arizona Department of Health Services, and the Pima County Health Department.
Thank you, Lonnie. So I'm going to ask for commentary from our task force members as well as from those joining us on the web. Mr. Osaran.
The materials that were provided were very helpful, and much of the materials led to other materials. For example, the Wynn Las Vegas had citations to the CDC that you could pull up and read those. And there's a lot of good recommendations as to make sure that we sustain a safe environment. But what I want to know is, through this task force, will the county be coming out with certain specific rules? For example, all employees must wear face masks, or, it was just suggested that if possible do this, or it might be suggested to do that. But is there going to be some hard and fast rules that any of the businesses here could go beyond as far as they want to go, but they can ensure they're compliant with what is in fact required?
Mr. Osaran, that's a good question, and it's been something that we've talked a lot about, whether the code needs to be amended on a temporary basis, or whether we offer official guidance. And that's part of the reason why we're having these conversations, is to get a sense from the operators. What I would like to see us is create a floor of minimum things that everybody agrees to, that would be the minimum best practices, and also have room for people who want to do more. And we have not entirely thought through exactly how we would recognize that. Part of our conversation is about how do we provide carrots rather than sticks, and how do we incentivize people to do the right thing, which is, I think, what our goal is. So what I'd like to get at the end of, and this group will not meet interminably, it'll meet maybe twice again, is some minimum standards of minimum things that we would expect all good operators to comply with, as well as some aspirational, like suggestions for folks who want to sort of go above and beyond. Lonnie, do you want to add to that?
I didn't realize my mic was still on. No, that definitely is true. We definitely need to get feedback from you guys and see how to move forward with these requirements. For lodging accommodations, this would more be on the operator to ensure that these things are being enforced or implemented. The message we got from our restaurant group is that public perception is best and key, so the more that you can promote what you're doing to follow these procedures, the better. That was a lot of the message we heard in our last meeting, is what can the public see that we are doing to ensure safe practices within our establishment. So they recommended posting the checks. Someone referenced like the restroom signage, this bathroom is cleaned every hour, maybe putting that in more public place, and it includes other areas in your establishment so the public can take a look at those documents as well. That was some of the feedback we received from the last meeting, is what does the public want to see and the actions that the facility is taking.
The idea is to create some sort of public-facing dashboard that we could all agree on, that you would sort of self-report to the public. Obviously, when we go in and look at your pool or look at your restaurant, we would be looking for those things too. But for instance, a gym that doesn't have food operations is not an establishment that we will typically go to unless they have a pool. But we do think that the idea of having these dashboards or report cards, for lack of a better word, that you could post somewhere prominently on your website, and you could say, I'm doing these 3 things that are absolutely essential to keep you as my guest safe and to keep our employees safe, I think would be something that would be productive. Other comments from the group? Mr. Durad.
Just wanted to point out too, especially with hotels and resorts, they also have pools, gyms, and restaurants. So as we come up with recommendations, and again, whether they're guidelines or requirements, it's going to be important to communicate all that out to the hotel operators as well.
Excellent point, Mr. Durad. Our resorts are particularly complex in this space. Mr. Stegan.
Yeah, in addition, most resorts have spas too, which are also complicated. Just more of a comment, my company, which is Wyndham Worldwide, is also going through the same process that we're all going through, and by no means is this required by every hotel, but I think one of the good ideas was that where possible, that hotels would tell their guests that this particular room hasn't been occupied for 3 days, and that's something that we can do in Arizona because we're heading into the slow period. Other parts of the country maybe not, but that's certainly something that we're going to be doing for our hotel as well.
That's an idea we hadn't heard before. Dusty, is there somebody on the web trying to get on? Oh, Ms. Dahl, please.
Hi. Yeah, I was just going to say that I think for all of us hotel operators, I run Hotel McCoy. It sort of similar to what Richard was saying. It would be really helpful to have all these suggestions as a requirement or a policy, because then it helps us not get pushback from employees. Like right now, our hotel, we're doing something similar to the last person that spoke. We're doing 72-hour turnovers between every room. So no one from our staff enters the room after checkout for 3 days, and then they deep clean it, and then it's rinsed out to give the virus a chance to die on most surfaces. We removed all throw pillows, and all of our employees are required to wear masks within 10 feet of a guest or each other. And that's been really successful in making people feel safe. And we have a couple employees that have pushed back. So for me as an operator, it would just be nice to have I guess requirements across the board that it's like, okay, every hotel is doing this. It's not just us being extreme. Thank you.
Thank you, Ms. Dahl. Any other comments from our participants on the web? Okay. Any other comments from the room? Ms. Mudd, please.
Hi, how are you?
Terrific.
So I am actually a local gym operator up on the northwest side of town. And my biggest concern through this whole thing when it comes to us reopening is that we are being categorized with the big box gyms. And so my question is, has there been consideration given, or would there be consideration given to looking at our processes versus a large gym where people can come and go as they please? When it comes to reopening, because we already have things in place. Like I can maximize my class sizes. I don't have to have, it's not an open door policy. People come in, we know who all of our members are. We're strictly run on classes. We're obviously going to do a huge deep cleaning before we open. We require hand sanitizer at the door. We have people clean their equipment after every use. So that has been my biggest worry, if you will, is that we are being put in that same category, and we're not the same. So if there could be some thought given to trying to, or differentiating, the smaller boutique gyms that have a little bit more control on what happens inside, as opposed to the larger gyms, I think that there's a huge difference between the two types of facility, if that makes sense.
No, I think what you're saying makes a lot of sense, in that we probably need to have recommendations that are scalable for facilities. The question has come up perennially since this started is, in fact, very soon after the governor's order, we were called up by one of the gyms saying, well, we're a membership only. Believe we should be exempt. Well, so is the Y, so is a lot of other folks, and nobody's exempt from the governor's order. I think that we will need to figure out how to tailor this for smaller operations and larger operations. I think, in a sense, the smaller operations, especially if there's a long-term relationship with your clients, with your students, whatever you call folks who use your facility, I think it'll make it much easier if you want to do a temperature and a symptom check at the time that you walk in. I can envision, at the desk at one of our busy gyms doing a quick symptom and temperature check as part of the process to go in, allowing people to have access after that fact. That's a little bit harder to do in some larger facilities, but I think there's ways of working this out. Other comments or questions about the lodging and gym area? Awesome. Lonnie, do you want to keep us moving? Or Mr. Huckleberry, do you have a comment?
The only comment I'd have is that after the restaurant and bar, we got several emails from members of the committee that, itemized certain things, and we thought that was very helpful. We could hear your oral presentations and take notes, but it kind of made it crystal clear when you actually responded in writing with an email. So please feel free to do that. And so I think the person who was on the phone talking about the difference between a large gym and a small gym, it would be very good if you could articulate that difference in an email to us so that we can clearly capture what your thoughts are as opposed to kind of guessing what they are. So the more you put in writing, the better off, and the more specific you are, the better off we'll be. And it's even to the point of where you're reviewing these, quote, lodging establishment, temporary regulations or temporary issues. If you have concerns or basically you think they're not going far enough or you think everyone should do this, please feel free to say so. Because this is kind of an iterative process to take in all of your input, come back, array it out there and say, okay, now what do you think about this? And my guess is that half of the things that we get put out there will be decided to be not practical or we can't do that, but we could do something else. So I think that's the whole purpose of the discussion.
Thank you for that reminder, Mr. Huckleberry. Super, super important that especially as you go home and you reflect on the conversation today, that whatever salient points that you want to share with us in writing, that you do so. You could send them to myself, to Lonnie, and to Gary. And we are cataloging all these, and they will live on the web, and we will be sending out a series of surveys to get feedback from the public, from the folks who are going to be using your establishments, to also sort of gauge their preferences and their take on some of these things. Lonnie? Oh, yeah. Good.
Sorry. Within the packet we provided, there is some guidance from the CDC about, I think you might be pulling it up here soon, guidance for cleaning and disinfecting public places, workplaces, business, schools, and homes. So this document has some really good information in there, and there's a bigger packet that we also included. So utilizing that resource for some of those facilities, such as gyms, would be great. Just wanting to let you know that it's in there, and then any feedback that you can provide us, we definitely welcome that.
Yeah, especially if there are any issues that you think we have missed, like, you guys completely forgot about X. This is the time to start surfacing those issues so that we can make sure that they get addressed. Mr. Oseran?
One point that Mr. Huckleberry made was that when we come in the door and to this hearing room today, we get our temperature taken. and as do all members of the public, and there have been cases in which some of the members of the public have exhibited signs of a high temperature. If you have a guest in your hotel who becomes sick, or you become aware that you have a sick guest, and what should you do? Should you call the Pima County Health Department and advise them that there's a possible COVID case in your hotel? You can obviously suggest to the guest that he see a doctor, but then you have perhaps an infected person on your premises, and somebody that person may need medical help.
Mr. Osterman, that's a really excellent question. And as I was reviewing the WIN policy and some of the policies of some of the national chains, it's almost like if you fail your temperature check, you don't get checked in, which to me was surprising. I don't know how people would feel about that. I think that the issue, you bring up a second issue, which is what happens when you have a guest who becomes ill. And the idea of having some sort of medical plan or referral plan to a nearby healthcare provider, I think becomes a really good one. Most resorts, most accommodations will have a list of like doctors on call or something like that. But I think that this needs to probably be even more formalized, sort of arrangements with urgent care, with the, to be able to assess someone. Realize that most of the time it's not going to be COVID-19. It just isn't, statistically. But I think that's part of how you provide reassurance to your occupants. Mr. Huckleberry, do you have other thoughts?
About the only other thing I would say is that the Public Health Department is your call of last resort, which simply says if you don't know where else to go, give us a call, and we'll try and figure it out. I mean, that's, because I can imagine that there'll be where you don't know, or you have a guest who might not be fully cooperative, and you just need to, let us know, and we'll see how we need to deal with it depending upon the symptoms.
And I want to sort of say that we have, in general, the health department and our staff have great relationships with most operators, probably born out of the fact that we need each other, especially when gem show season is around. So we are used to receiving calls from the operator at X resort saying that he or she is having Y problem with a guest or that is health related. We did this with Ebola. We've done this with a variety of things. So we've exercised this muscle before. So we do want to be your resource. We do want to help you figure out how to address those needs. But we also believe that you do need to have probably a formal relationship with some sort of urgent care partner or some sort of acute care partner that will be able to provide some immediate resources on the ground if needed. Other questions? Mr. Dawson.
Thank you. Comments and questions. Just curious if you're going to be giving detailed guidance on everything from locker rooms and showers and when those get to open, or do we get to decide that on our own, as well as, like for pools, we haven't even been able to hold an in-service for a month and a half, so there's no way we're going to be, if you say I get to open tomorrow, that won't be happening for a few weeks. So are you going to be getting into the weeds? Are you going to be keeping it at that 20,000-foot level that you need to do these standards and then apply it to what your space, your size is?
I think in general, our goal, Mr. Dawson, would be to provide minimum standards that then we will let you exercise your creativity to meet, because I can't imagine that we will know what every single pool at a Y looks like and what every single locker room looks like. I think that there are certain general principles that we are trying to make sure get adhered to, that we need to optimize the distance between our guests, especially guests that aren't in the same party, right? So if they're not in the same room or are not in the same family or family unit of the folks that you serve, we want to maximize the distance among our guests. We want to maximize the amount of sanitation and disinfection that goes on for high contact surfaces that are in public areas. We want to make sure that there are processes to identify people with symptoms or with illness and make sure they don't ever get into your building. both as customers and as employees. I think we want to have some of those things sort of memorialized in a way and then turn those over to you. But I'm also hearing from you as operators that some degree of specificity and direction would be good, i.e. saying thou shalt wear face coverings if you are having interactions with the public. That may be a good thing for us to, if not codify, but provide as guidance. Yes, Mr. Dawson.
Yeah, because I'm not going to have staff sitting in the shower watching to make
Right.
sure we don't have too many people in there, just to be clear. We don't do that now, and we're not going to do that in the future. But obviously, I'm in contact with YMCAs across the country, and there's everything from 25%, or you have to know what the occupancy load is for that room, and you could have 25% of it. I know there's a balance of too much detail and not enough, but it is kind of rewarding that we get to just point at Mr. Huckleberry and blame him as much as possible, the things that we have to do. The other side is we've been operating emergency childcare since March, 19th, and we've been, it's curbside drop-off. Parents don't even get to come in the building. Every single staff person has to have their temperature check. We do a wellness check. We actually even ask where they've been, if they have been not just to home and work, so that we can know exactly what's going on. And for all of my staff, they've been very appreciative. The parents have been very appreciative. And so much of this next phase for us is building confidence in our patrons, confidence in our members, and making them feel like not only do I see signage, but I see action backing up that signage to make me feel safe. And the sooner that happens, I think the sooner we get to move forward and get back to business.
I couldn't agree with you more, Mr. Dawson. I think that it's not just optics, by the way. It is about us sort of walking the walk and us doing the right things in public and visible ways that sort of set an example for both our patrons and our employees and our community. And I think that we will strive to provide sufficient guidance to give you coverage, so you can always blame us, but not so much that it impairs your creativity. Mr. Huckabee.
About the best way to explain it is that we're going to tell you to physically distance the minimum guidelines. How you arrange your equipment or how you do it is going to be up to you. And it's to the public, when they see it, they know it. And so it's usually pretty obvious. So I think we're going to be more or less along the overall arching guidelines, as opposed to strict things that tell you how to arrange your equipment.
I think it would be helpful, along with guidelines, to have a series of recommendations, because a lot of the entities that aren't here today or won't even see the report coming out of this task force will see ultimately, hopefully, a report that will give them the information and the recommendations, and it'll be ideas that they hadn't thought of. And that would be very useful, I think, to include along with the requirement level.
And that's the goal. So, and that's part of the reason why we want you to memorialize your comments to us, so that as we're sifting through them, we can pick and choose the ones that are kind of recurrent themes, because I think you're right. We don't think, honestly, the idea of getting my temperature checked in a bar had never crossed my mind until it was brought up by an operator during our last meeting. I would have never thought that was even a possibility. And again, we want you guys to sort of exercise your creativity, and if you want to do more, do more. But we want to definitely provide you some firm guidance on what the minimum is that you must do to operate safely in Pima County. Other comments? Dusty, from the web, from the callers? Ms. Dahl.
Hi. I just, since I have so many people in this meeting who are experienced hoteliers, and this is sort of a new ride for me, and obviously a pandemic's new for all of us, I just wanted to pick everyone's brains for what opinions were on throw pillows and throw blankets in the hotel room. It's just, you can't really wash those. And we haven't removed ours yet, but I'm leaning towards it. It takes away from the aesthetics, but that seems to me, if you can't wash something, it kind of needs to go right now. So I was just wondering if anybody else had implemented that policy or thought about that yet. So
I'll tell you, Ms. Dahl, that this was what I've seen done is those things that they put on the foot of the bed, bed shawls or whatever, those have been gotten rid of fairly uniformly in most hotels, at least when I look at some of the national chains. Most have also gotten rid of things that are, even though they're made of fabric and even though the likelihood of transmission is extremely low, most have also gotten rid of some of those amenities like pillows. I don't know if any of the other task force participants want to make a comment.
Thank you.
Or the staff. Yes, Mr. Teagan.
We haven't thought about that yet, so haven't got that far.
It is the kind of thing that as you think about it, more issues come up. Other questions, comments, Mr. Huckleberry?
Just back on the one comment about, recommendations. One of the things that we did early on in this discussion was we went back and forth with what is a minimum requirement and what is the best practice. And what we finally settled on is, well, if it's a best practice, why shouldn't it be a minimum requirement? So we're still struggling with that because, there may be, some differences between different operators. And so, we'll still try and segregate those into minimum requirements and best practices. But some of our earlier conversations said, well, that's a good idea. Let's have best practices. And someone said, well, if it's a best practice during a pandemic, why isn't it a minimum requirement? So that's where we kind of put a big question mark in the air and said, well, we don't know the difference at this point.
For all of us, we're dealing with lots of new challenges. Mr. Osaran?
I think also the structure of whatever is the final form of this has to constantly be modified because we keep getting new information about this disease on a regular basis, and what we think we know turns out we don't, and what we don't know becomes more obvious. So there needs to be either the task force itself to meet periodically or a committee within the county to address new issues and amend and addend the requirements and the suggestions as they're needed.
Yeah, let me give you an example, and you're right, because that's why we're probably going to tag all of these as temporary requirements or temporary recommendations or temporary conditions, because, what we've been doing in pools has been basically all directed toward waterborne disease, and we're dealing with something entirely different now. And so it's like, how do you mix the two? So we're having, that absolute same struggle. So I think in our case, a lot of these will be classified as temporary, regulations or temporary conditions that'll have to be revisited almost on a pretty frequent basis.
Yes, sir, Mr. Blumenthal.
Thank you, Dr. Garcia. A couple of just observations. For some businesses that may be under some umbrella of essential, the minimum threshold of compliance or enacting, health measures to protect workers and the guests it won't matter to people because they're going to go. I mean, it matters to people, but not to the extent that they're going to make a life choice of whether they go. And then other businesses, and perhaps it's more restaurants and the like, it'll be a factor of, do I feel safe in that environment in order to choose the one that I go to? So a question I have gets back to a liability context. And that context is, and it's more of a question, to what extent has the county considered for its businesses some hold harmless arrangement or agreement that patrons might sign before they walk into a gym, or whether they've been a member or not for years, or a private club, or even in the hotel, the industry. So if you have any thoughts or comments or experiences with that, I'd appreciate it. Thank you.
Mr. Huckleberry, if you want to make a comment, I haven't.
I think everybody's looking at each other. What you're really is basically saying anytime anybody enters an establishment, they have to sign basically a hold harmless, and so that's a pretty tough measure.
And even tougher to enforce.
Yeah, how do you enforce it? And it's kind of like
in court. I mean,
it becomes this standard norm that makes everybody feel good, but does no good. So that's part of the problem. So, yeah, it's. I think from our perspective, we include hold harmless agreements in all of our contracts and clauses on certain areas, and it's a standard boilerplate that Richard knows you put in any contract that you never have to use. Tough issue.
I hadn't heard the issue quite articulated that way, and I can see where you're coming from. Perhaps I'll ask the county attorney to give us some insight as to if that's even a possibility. Other comments? Yes, Dusty. Mr. Volland?
Yes.
Go ahead.
Are you there?
Yes, we are. Please go ahead.
All right. Russ Bond, JW Marriott Star Pass. And to answer the earlier question in terms of removal of items from guest rooms, we early on removed all throw pillows, coffee makers, robes, magazines, glassware, and basically are replacing them only if a guest asks, and then we clean them between use. And to follow up, just to say thank you for this opportunity and allowing us to be involved in this process.
Thank you, Mr. Volland. I had heard that about your facility, and it's in line with some of the bigger resorts that, at least that I've checked into. Other questions, other feedback before we conclude? So just to give you an idea, an expectation of what will happen next, we're going to memorialize the conversation. We are going to try to create a survey that we will push out to the general public to get their feedback also on what some of these concepts are. And then we will reconvene this group with probably the next iteration of these guidance documents so that you can give it another look. Our expectation is to try to do that in the next 7 to 10 days. This will not be a group that meets indefinitely for ever. It will probably meet 1 or 2 more times, and that's it. This particular group is part of the much larger back to business effort that the county is trying to shepherd along. There are a lot of different components. We are trying to bring a lot of different subject matter experts in different areas together to opine, to provide guidance, and then rolling that up to a larger group that will provide guidance. So that's how the process looks from 20,000 feet up. Mr. Huckleberry, any concluding remarks?
No, just a reminder that, we would appreciate your written feedback or suggestions. They're all welcome.
If there are no further comments, I will, Mr. Oseran.
I just have one comment. I want to make it now. I noticed in this morning's paper that the CARE Act is providing, $95 million to the city of Tucson, and I'm sure the county's also going to be the recipient of funding. And I'm wondering if, and of course the big question is how it can't be utilized and how it can be utilized. But as hospitals, and they need PPE equipment, so do the hotels. And it would be great to have a resource where, even if the hotels were charged to a certain extent, that an investment could be made in securing the kind of equipment that will be necessary based on the suggestions and the requirements that this committee comes up with.
Yeah, and we agree completely with that. And we have this, if you go to our COVID-19 webpage, you'll see survey 123 or 123 survey. Can't remember what it is, but it allows you to register in there and request PP&E or any other things that you want. and we'll get you on a list. And, you know, apparently we have a whole bunch of things sitting in China somewhere at this point in time. But yes, I think you're exactly right, because if you even look at the guidance in here that we handed out to you, they talk about supply of PP&E for folks who work in the lodging industry. Perfectly correct, and we ought to be in the business of at least getting you supplied with that so you can get back in business. So yes, we'll kind of run you through. What we'll do is we'll
I'll send the website to everyone.
yeah, it's survey 123 or 123 survey.
Survey 123 on the COVID. It's www.pima.gov/COVID-19. There will be a tab for resources, and I will also send you the link so that you can use it. For me, it is hand sanitizer, especially for your environmental staff, right? Hand sanitizer, gloves, isolation gowns, or some sort of clothing protector, and masks and eye shields are the kinds of things that I think are going to be important for you to have and to be able to provide for your employees in order for them to discharge their responsibilities safely. We have been challenged with a supply chain that right now is just not working very efficiently, and we have a hell of a lot more requests for PPE than we actually have PPE in hand. I can tell you that the minute that we get it into the warehouse, we are turning it around to our partners. So, but please do put your request in, not just to memorialize it, so that we know that you have an interest in that. Mr. Dawson, did you have a comment?
Yeah. What email address do you want us to use to send written comments?
Francisco.garcia@pima.gov.
So not Mr. Huckleberry.
No, not Mr. Huckleberry.
I'll read them all.
Or the person who organized that, Ms. Suzanne Goodman, who is here with us today. She's the name that is on your invitation. So she is also the person that you can send that to, and Suzanne will collate those and get them to us, and we will get them onto our website. Other comments or questions before we adjourn? I really, really appreciate your participation. I realize that we are in the midst of something that is unprecedented, and I think that your partnership is really critical if we're going to figure out how to come out of this looking like a better community and a better Pima County. So thank you so much.
Thanks for using WebEx. Visit our website,